Hola, buenos días.
Hello,
¿Cómo
everybody.
están?
It's a
Qué
pleasure to
alegría
have everybody
tenerlos
here today.
por aquí.
Okay.
Just in case you don't understand what I was
Vamos
saying,
a tener una
we are
traducción
having
simultánea de español a inglés.
translation from Spanish to English. In the interpretation
Pueden
channel,
escoger inglés o
you
español
choose English or
y
Spanish,
podrán
and you will
escucharlo
be able
en el idioma que
to
prefieran.
listen to it in your preferred language. Nos da mucho gusto poder contar con todos ustedes participantes
It's a
aquí
pleasure to have
en
everybody
nuestro
here in our
panel,
Latin America panel.
sobre Latinoamérica. Estamos,
We created this
este
panel
panel lo
with a very
creamos
important
con un
purpose
propósito
for us,
muy importante
which
para
is bringing
nosotros,
the
y es poder
researchers closer
acercar a los
to
investigadores
academia, to what is happening
y
in
a
the
la
real life
academia,
in
a lo
the
que
Latin
está
American
sucediendo en
context,
la vida real, en el
what's
contexto
happening with the
latinoamericano,
context
lo que está
with COVID.
sucediendo en el contexto de COVID. Y es por ello que hemos
This goes to
invitado
practitioners, to
a
professionals, or
practitioners, a
working in international
profesionales que
organizations, in
están
the public
trabajando en
sector,
organismos
in
internacionales, en el
ONGs,
sector público,
different
en
projects that
ONGs
have
también,
direct contact with the
diferentes
Latin American
proyectos que
reality.
tienen contacto directo con la
This is
realidad latinoamericana.
very
Y
welcome,
creo que esto es
especially
muy
for
rico, sobre
research
todo
that
cuando
has
queremos hacer
social or positive
investigación que tenga
impact.
impacto social o impacto positivo,
When we want to
cuando
have
queremos hacer
research that has an
investigación
impact on
que
public
tenga impacto en
policies, because
políticas
public
públicas,
policies are those which
porque la
put
mejor
people at
política
the center.
pública es aquella que pone al ser
To
humano
achieve
en el
this,
centro.
which is
Y
very
para poder
important,
hacer ello, para poder lograrlo, es tan importante
we must know
poder
what is
saber
happening with
qué
these
sucede con
citizens,
esos
with these
sucediendo
families,
con esos ciudadanos, con esas
because there's
familias,
stories behind every
porque
one of them,
detrás de cada una de ellas hay historias que contar,
and
hay
very
vidas
specific needs
y
as
hay
well.
necesidades específicas también. Y creo que
So this panel will
esto
give us a
también
very interesting
nos va
perspective
a dar una
on what has been
perspectiva muy
happening in Latin
interesante, muy
America.
profunda de lo que ha estado sucediendo en Latinoamérica.
Obviously, this
Obviamente
is
no
not
es,
the
no es
the
toda la
entire perspective, but
perspectiva,
it's an
pero
overview of what is
es un
happening,
overview que nos va a permitir ver lo que está
and it will also open
sucediendo
the
y
door
también
for
nos va
us
a dar,
to
yo creo que nos va a abrir puertas
find
para
academic
explorar
solutions
soluciones desde la academia,
to the
iniciativas desde la
different
academia que
problems.
puedan solucionar
So welcome to
los
this
problemas
panel,
que tenemos.
this space.
Bienvenidos a este espacio.
I want to
Quiero
introduce some of
presentar
the people who are with us today.
a los que nos acompañan el día de hoy. Voy a iniciar con
Betica Muñoz Bogosian. She's director for the Inclusion Department in the OEA.
De la Organización de los Estados
She has a
Americanos.
PhD in political
Ella tiene un
science
PhD en ciencias políticas
from the Florida
de la
International University.
Florida International University.
She's a master in international relations
Máster de Relaciones
from the University of South Florida.
de la University of South Florida. Nos da mucha alegría que Betica esté aquí.
We're also going to introduce
También
Nancy
les voy a
Romaldo.
presentar a Nancy Romaldo. Nancy
She's a
es
professional from the
especialista
Universidad
de la
Nacional Mayor de San
Universidad
Marcos
Nacional Mayor de San Marcos,
with a focus
con una
on social
maestría
projects.
en gestión de proyectos sociales de la Universidad Peruana Cayetano
And during the
Heredia.
last 8 years, she has worked as a coordinator for
8
projects,
años ha trabajado como coordinadora de
and
proyectos en
social projects in
de
Peru.
salud en Perú.
She's going to tell us about the projects she's been working on. Welcome, Nancy.
Que vienen trabajando ahí. Bienvenida, Nancy.
The next person is.
Bueno, continúo con la siguiente persona.
I'm rushing a little bit because we know we have a very tight schedule.
Tenemos un tiempo un poquito apretado.
Rocío Maciel,
Rocío
she's a general
Maciel,
director for
ella es,
human
directora
rights,
general de derechos
the
humanos
legislature
de la
of Buenos
legislatura
Aires.
de la Ciudad Autónoma de Buenos Aires y es miembro del buró de
She works with the party Coalición Cívica
Coalición Cívica
and Together for Change, Juntos por el Cambio.
y Juntos por el Cambio.
Studied in the
Ella
University of
es
Buenos Aires
por la Universidad de
and has
Buenos
worked as a
Aires
consultant for
y ha
human
trabajado
rights.
como consultora en derechos humanos y transporte.
Finally, we have Juan Manuel Arribas Berenson.
Manuel Arribas
He has more than 22 years
Juan
in
Manuel
strategic
tiene más de 22 años de experiencia
planning
en
for
temas
social
de
responsibility
la
and
responsabilidad
communication.
social y comunicaciones.
He has directed important
Ha
projects.
dirigido proyectos importantes
He's currently director
público y privado
for business solutions against poverty,
ejecutivo de soluciones
Hombro a Hombro.
empresariales contra la pobreza.
It's a movement led by entrepreneurs,
Hombro a Hombro es un movimiento
which has had an
empresarial
important role
que
during
durante
the
la
pandemic
pandemia ha jugado
in the
un
fight
rol
against
importante
COVID-19.
en la lucha contra el COVID-19.
They have offered more than 6
Llegaron
tons
a
of
6,000
human
toneladas de
relief.
humanitaria a comunidades vulnerables en el Perú.
Thank you to all our panelists.
A todos nuestros panelistas, bienvenidos.
Thank you for giving us some of your very tight schedule to us.
Agenda para compartir con nosotros.
And we will start with the first question
Vamos a
that we have
iniciar con la primera
in the panel.
que tenemos aquí en el panel.
And the first question for each one of you
La
is,
pregunta es,
what has been the role that you have led?
¿cuál ha sido el
within your organizations
a ustedes
in
desde
this
su punto de
COVID-19
vista
pandemic.
durante la
We will
pandemia.
have about 5
Ustedes,
minutes for each one of you to answer this question.
minutos por cada uno para poder responder esta pregunta.
We can start in the order we presented you.
Vamos a iniciar de pronto en el orden que les presentamos.
Excellent. Thank you very much, Christian, for this introduction
Muchísimas gracias, Cristian,
and for the invitation to this important talk to connect theory with practice. So thank you for so I'm representing the OEA, which is an organization, a multilateral organization in the hemisphere with 35 member states in the organization, focused on democracy, security, development, and human rights. Throughout the pandemic, of course, it became in a space for help and to find challenges and solutions within two perspectives. Politically, of course, with all the governments of the region, we agreed to solve issues such as what are the main affected populations by COVID-19, what are the public policy answers to solve these issues, and some of the most hot topics has been the just distribution of vaccines, under the understanding that there must be equality in such distribution within countries and within countries. So this has been an important part of the discussion. From my role as Director of Social Inclusion, in his secretariat focused on human rights in rural areas, we have given visibility to very vulnerable populations, such as informing how COVID doesn't affect equally a person from a certain country compared to an immigrant who will be much more affected by COVID. For example, an immigrant tends to live in very close quarters, small areas, just in order to save money so they can send money to another region, or because they depend predominantly from informal markets, or for instance from men versus female, all the violence or domestic cases of violence were much more important for with women than with men. Situations such as these were release and escape, so for the aggressors. So COVID led to these cases. So we mapped out all these cases, and I would focus specifically with one result, which is a practical guide of inclusive answers focused on human rights, in which we established specific cases and guidelines for public policy to protect these populations, so such as African Americans, immigrants, LGBT, men, women, children, older people. And to close, because my initial time is running out, the main posture we make, because we're an organization that works with governments that have a responsibility to design initiatives, programs, projects, public policy that affect or that have a massive impact, which is an advantage of working with governments, because the work we do, we know, has a greater impact on people. The main message, or what we always try to focus on in these situations which are still affecting us all in the region, is to try to design public policies with three main characteristics: focused on human rights, focused on equality and non-discrimination, and focused on intersectionality. When we talk about rights, we refer to the OEA being defenders of norms that defend human rights. And to have a public policy focused on human rights means looking at these norms that protect rights and aligning our responses to achieving these goals, to these rights. We can talk about this later on, But we do have that goal of translating what is on paper into our everyday lives. Focusing on equality and non-discrimination means making visible the differences of how people leave these crises, how people benefit from public policies when designing them. And finally, on intersectionality means recognizing that one person can have multiple identities that add or subtract rights or access to rights. So, in a very fast, broad summary, that is what we do during the pandemic. Thank you for your participation and for the role you have on your Latin American context in the COVID crisis. We're also going to talk about what they have been doing during this time. Hi, and thank you everyone for the invitation or for the opportunity of talking about what our social health partners have been doing during the pandemic in 2021. Socios en Salud is a partner of Partners in Health in Peru, and they have four main lines: mental health, sicknesses that are non-transmissible, and I missed that last one. She currently works in a place, in a project called Casitas. For everyone, COVID was definitely a pause in all of the activities that we were carrying out. And the goal of Socios was always to offer help to the most vulnerable population. This pause that we had during the pandemic was at the moment a challenge, but it was also useful to assume a role of initiative, of having interventions that we already have planned and adapting them to our virtual context, given that the measures that the country took towards this pandemic, such as quarantine, led to this. That is how, leading this project that I have, we try to adapt a physical intervention with scientific evidence, which has been running since 2013, and which tries to identify the population with 10 or less years with development problems. The first questions were, where are these people? Who are these people? How can we find them? How can we identify them? How is their situation? Let's not forget that kids and their health depends on their entire environment or context. Furthermore, such as Betile said, it was very noticeable that the context lived within the family could even be toxic for a kid. Stress on mothers increased, problems in the houses increased. There was no access to healthcare, so that's what happened throughout this context that we will speak about further along. In this context, we could adapt this intervention. We designed a chatbot that allowed us to identify the population through learning where the kids were located, links that were rapidly spread throughout the population using WhatsApp or social media. Another important goal was adapting our educational materials to share with all the caretakers throughout this experience. And that was very important because we involved the entire family that could be involved at that given time, such as parents, fathers, brothers, second caretakers, main caretakers, so they could also help with the early care of children and their health. That is basically the work we were doing throughout the pandemic. It was very important to identify high levels of depression in parents, male parents. Even with the problem of COVID, some families did not respect the quarantine or even left their homes to socialize, especially because they had very strong socioeconomic needs. So we had to work very integrally, focusing on the kid, but also and all the factors that they could be around the family, maybe depression in the caretaker, providing some sort of socioeconomic help, providing medical help to the family through telemedicine, remote medicine. It was very important for the organization to identify the population that was most being affected. We worked with the regional director to identify cases that could be at risk of COVID and provide protection kits and offer constant care to prevent any spread of the virus throughout a family. So those were the main goals or main achievements we obtained. I have 1 minute left, so I do want to talk about mental health, something that also started to massively in these pandemic times being an issue. We work with different institutions, and we also created a group of chatbots to counter depression in people older than 18. And through teleguiding or remote guiding, providing them care. That's what I could say about what we've been doing throughout the pandemic. Excellent, Nancy. Thank you for telling us what you've been working on with children in the context of COVID-19. Our audience can, if they have any questions, leave them in the comment section for our Q&A chat. We'll be checking them to answer them throughout the panel at the end. We'll now present our next panelist. She's Rocío Maciel, and she's from Buenos Aires. Welcome, Rocío. Thank you for the invitation, Christian. Thank you, everyone who's participating. While I was listening to Batilde and Nancy, I was thinking how many things unite us in Latin America. It may seem that we're all in our home country, but much about what was talked about by Batilde and Nancy, we're also living in Buenos Aires and in Argentina. As you said throughout your presentation, 2019, I became General Director of Human Rights in the legislature of the city. That was in 2019. We had 3 months of in-person work, then the pandemic hit. And we had the challenge of seeing how we were going to work to continue with our labor. In that sense, we focused a lot on observation, on watching on what was human in terms of human rights throughout the pandemic, but especially with quarantines. In this sense, in this moment, we noticed much about what was talked about by Batilde and Nancy. Gender violence throughout this period increased. It was a year with most femicides in Argentina, in the history of Argentina, derived from everything they were talking about. Quarantines, with houses being insecure, and other of the issues that appeared had to do with mental health, as mentioned by Nancy. Let's take into account that everything that was 2020 in Argentina, kids were 7 to 8 months without classes, without a single day of class in person. So that obviously led to sociability issues. Friendships were broken between kids. It caused thousands of problems to adolescents. That's a specific sector that we're talking about. So that was an issue for our public sector policies. In this sense, it clearly caused not just an educational crisis, but also an emotional crisis and mental health crisis. One of the issues that also helped us to create liaisons with civil society was the abrupt fall of donations in Buenos Aires. It's a place where people tend to do blood donations. It fell 80% because hospitals became insecure. So what we did there, along with civil society, was finding other places that weren't hospitals. That is how we gave a new sense to school, a new purpose to cultural centers, to libraries, to clubs. We used those places that people could could go to donate their blood. That was, I think, the context of this panel. It's a symbol that when there's a liaison between civil society and the state, public policy can have truly a change. It can change and have a true social consequence, which is what we're always striving to achieve in government departments. So having an impact on society. It's a small example, but I think it's important to bring it to your attention, this panel. I don't want to exceed my time. I think I have 1 minute left. But another of the topics that I think is important to note is how the legislature of the city was going to work regarding legislators, how they gathered to keep legislating and carrying out solutions for the population. The City of Populations was the first Argentinian parliament that could have a session, and they found a way to have sessions mixed, which was in person and in virtual. So presidents were of blocks were in person, and the other voters voted from their homes. It's not a minor topic because we had to create new systems to achieve that function within the state. And we worked on this very quickly because it was very important for legislators to be able to gather, to talk, to give solutions to business people, to everybody, to agriculture, to education. The city of Buenos Aires was the first one to reopen schools, the first one that gave an answer to commercial businesses, so the economy didn't die in Buenos Aires. And I don't want to keep exceeding my time, so I'll wait for the next questions. Thank you very much. Thank you, Rocio, for your intervention and that vision of what was happening in Buenos Aires throughout COVID-19 and all the challenges it represented for Buenos Aires. We'll now go with Manuel Arribas Benson. Welcome, Juan Manuel. Thank you, Christian. A pleasure to be here, and thank you for the invitation. I'm a founder and current executive director of the poverty organization, combat organization. It was born with the purpose of designing and executing public policies based in evidence, with the know-how of the private sector to make things happen, with the ability and the management that private sector has. Our initial work had an excellent work with organizations. We had more as a think tank. We intend to be. We have proven throughout our pandemic sessions. We've worked in the Amazons to establish a nutrition program in the Amazon. That's very big. We've been with the Minister of Education. We've restructured logistically in the ministry. We've been with Centrum, with the Social Progress Index. We've been in different sectors of the state. But in terms of disasters, we've just been tending to this issue since 2017, when El Niño affected terribly our country. There was no organization in the private sector that could consolidate all the sector to centralize operations, share information, and make help more efficient. That is why with the state, there were some organizations that were responsible, but invisible towards the very government. As we say in my home, we jumped on to this issue in 2017 without knowing how to read or write in terms of disaster intending to this issue. Working with entrepreneurs was very natural and easy for us. Taking leadership from or leading the private sector to work with the state to coordinate, and we must have done a good work because the Ministry of Defense named us as representatives of the entire private sector in the operation for emergencies. This was very important. It caught the attention of important companies in the country, and they asked us to manage within our organization a new business front towards disasters, to be much more anticipatory with our responses to disasters and not rushing at the last minute to try to solve and coordinate with actors. That is how the organization Shoulder to Shoulder, Hombro a Hombro was born. It was proposed as an answer to the earthquake in Peru. We have a threat of an earthquake in Peru. We're expecting an earthquake rated 9 with about 200,000 death peoples expected in a city with 10 million people, without water, without airports, without highways. That would be, frankly, hell. But we never thought of a pandemic such as this one, this scale. So what we did was rapidly adapt our response, our earthquake response, to a pandemic response. We took all the help of the private sector within this civil society organization, worked with the armed forces to create food kits for families of 4 this time. It was immediately clear that our commitment had to expand to much more than response to disasters, because in the end, to this day, we have achieved to transport over 6,000 tons of food and beverages, delivered to more than 600,000 people in very vulnerable conditions. We've brought the first batch of 1 million vaccines to Peru, so that's how we started with this vaccination process in the country. We have implemented over 20 plants or factories for oxygen, for healthcare. We have donated over 42 regulators of high-pressure regulators that in Peru we call guairachis. We proved that our hypotheses work, or the work hypotheses, that teamwork with the state and the private sector works, despite the enormous distrust, mutual distrust between the state and the business sector. Never before in the history of Peru had there been such a level of coordination and support. Dr. Arellano, a market researcher in Peru, said that the internal gross market grew 4 times as greater, percentually wise, compared to the United States. So I will complement this information further on in the panel. Thank you, Juan Manuel, for your intervention, your great work you've done with Hombro a Hombro throughout the pandemic and offering help and throughout this pandemic, these times. We're a little short in time. We're a bit of a sandwich. We're kind of between 2 panels. We're going to do something that's very interesting. We're going to join the last 2 questions.
unir las últimas dos
What have been the great challenges that you have
¿Cuáles
faced?
han sido los grandes retos que ustedes han enfrentado? ¿Y cómo
And how do you think that academia could help to solve them?
que la academia podría aportar de pronto a la solución de estos retos? Creo que va muy
We're going to start in the same order with
Entonces,
Hilde,
iniciamos de la misma manera con Betica.
and we have 3 minutes to answer this question.
Para intentar responder esto. Esperemos que podamos hacerlo.
I'm going to take care of my time just to make sure I don't exceed my time. I think we've talked about or starting to map out the challenges as an additional commentary and what involves my work specifically. The virtual world, which has been mentioned by Rocio and Nancy. Our Latin America has very big technology gaps. So this idea that we can all study online, that we're all connected and coordinated, is not always true. It's a key issue. Financing is also an issue. We work with donors for our projects, and of course, Latin America. 2020 had a negative growth in donations. In 2021, there's about a 3 to 4% growth in donations. There's a bounce back, but it's not enough to place the region where it was before in 2019. So that also has consequences when working on projects and deciding public policy from the point of view of the government. So there's greater needs, and there's the same budget, government budget. And the third issue, which I already referred to, and I think Nancy mentioned as well, which is a great challenge for the region throughout the pandemic, is poverty, which is going to increase. We'll have new people in poverty, food insecurity. Nancy gave us a vision of Peru, but it's also seen in Haiti, in Venezuela, in the entire hemisphere. In Guatemala, Honduras, and El Salvador, that is also going to be a huge issue, a massive issue for Latin America. What can academia do to solve this? Continue to generate data. The countries in the region have been building good information infrastructure, but it's still too low for the needs and the degree that we need to take better public decision policies, public policy decisions. Analyzing solutions, especially this focus on building scenarios, which is very useful for people who are making public policy at a technical and a leadership level. And third, the research that is generated should not remain in cabinets. It should not remain in a conversation between academics. It should transform into data, into information, into policy papers that are easy to digest, and not because government people don't have a good degree of education, but because of the people in public policies don't always have the time to process all the research and information. So it's key to transform these content into useful information for people who decide on public policy, so they can have an impact in our reality. That's what I would say about this issue. Thank you, Beltile, for your information. Excellent data. Thank you, Chris. What we can work on is implementing or experiences. One of our greatest challenges, it was access to social media, to the internet. It's a great issue, especially in rural areas and in urban areas. However, I consider it's also important to involve civil society in everything that we can adapt. Although the challenge is how to adapt something that we were already doing, which is proven to work, that our interventions could reduce issues. Taking it to a pandemic context with a population that has different needs at that time became a great first challenge. As I mentioned in my first intervention, we didn't know who they were, where they were, how we could reach them. We lost a lot of population which had been previously contacted. That was a great difficulty that up to this day we are trying to solve. But there's definitely populations that we're not reaching. Imagine that this is also true for other institutions. We have to find a way to solve it. That's why we innovated with chatbots. It's a way to reach different regions. But if they don't have an internet package, if they don't have a paid internet service on their phones, well, that's going to be an issue. We also worked with strong community agents. They are our right arm in our projects, and they are responsible for delivering interventions to populations. They're not just support people or help me with something very specific, but they have a key role as actors. Imagine the challenges of this previously being an in-person training, and now we have to transform the entire dynamic with many of our agents, and many of our agents are older people, so they're not so fluid or adaptable to Zoom and WhatsApp. So all of that meant a training process of empowering this population to make sure that it was them who can reach the population and also help us gather information from the communities. Because I can organize my project from my table, but if you don't have evidence from the community, there probably won't be any medium or long-term results. So when talking about science, I am very pro implementation based on evidence. We can gather that information and scale it up. Evidence is something that in academia has to always consider and implement based on involving actors in the community. That is basically what I would like to share. And if there's any other questions further along, I'd be glad to answer them. Thank you, Nancy, for your intervention. I'll try to be as brief as possible. A topic that is a strong passion of mine has to do with focusing on studies, studying the families, but not just traditional families, but also diverse families, LGBT families. In this sense, a challenge of ours is solving how LGBT families are being exposed by the COVID, as they're in worse conditions than before. This is issues with enrolling children from LGBT families, issues to register children that are born within these family units. There are families that are already built. We have to be able to guarantee the same rights to them. That is an issue and a topic that in the city of Buenos Aires we have solved. Since we approved equal marriage rights, it's a population that is no longer, if you want to refer to it this way, no longer a minority. We have to be able to guarantee their rights, demand rights and laws for them. Regarding academia, I don't want to be too critical or for this to be taken completely critical of academia, but then in government, we want academia to be a nexus between civil society and the state, but also find a link between academia and other actors. Because as Nancy said, ideas exist, studies can be made, but they don't get to the people who have to see them. So we can go to panels, to congresses, we talk there, we say there what we visualize. Academic formation also has a sociological background. Oh, that's as far as we go. We have to be able to do more. We have to be visible. We have to be able to sit with the decision makers and also with civil society and have a double check mark to ensure that what we study is effective, and then in conjunction between civil society and academia, do lobbying with the state or political actors, so we can reach the political policies that we need, public policies that we need. So I'm an ally in that sense. If there's any questions, we can answer them.
Muchas gracias, Rocío, por tu participación. Y ahora pasamos a Juan Manuel.
There's a little time for me, Christian, but okay. Greatest challenges that we have faced. I'll start by saying the best that we've had so far is the enormous commitment from our medical staff in all the countries that faced for over a year alone with no sort of defense against the pandemic, to protect our people, our armed forces, and our national police. All three of these groups are absolutely extraordinary people, and thousands of them paid it with their lives, with no sorts of protections that exist to do their work. If I'm forced to talk about obstacles, I have to sadly talk about our state. That distrust towards the ability of the private sector is still existent in the government. In terms of logistics, associations, oxygen, etc., there's no knowledge on the importance of the communication role against the pandemic. We had to fight against the resistance against vaccinations that we have at this time throughout the world. The inaction of many departments, like the Secretariat of Health, the lack of knowledge of the state on how to manage a crisis of this scale. Institutions were unable to manage a coordinated effort, unlike, for instance, how the United States or Israel or other countries solved this issue. An inability to make public data public in a single system to map and locate the populations that need tending to. Despite us in the private sector offering at different times and freely this data, the urban data is very old. It makes it very difficult to plan. We will go to X Street, and when we get there, there's 50,000 more people than initially expected, so that makes planning very, very difficult. There was a certain fear to talk to other departments in the government, such as the armed forces, and and the health ministry was unable to have any sort of implementation logistically. These are some of the obstacles I would mention, and that's just based on my fighting experience. We've been in the trenches fighting this crisis, and that's what I can tell you about it. In terms of academia, it would be magnificent if we could tell the state about implementing a centralized command center. There can be no program or any sort of military implementation if there's no center of command and control. Same goes with private companies. When there's a crisis, a center of command and control is open to centralize information and decisions. Having just-in-time information, so decision makers can take decisions or make decisions. Managing information with a single voice, and proving to the state that it's important for there to only be one main voice, not 4 or 5 people who spread information, can at times offer contradictory information. Having a communication strategy that is a nationwide strategy that reaches people throughout the country. Our country has 52 different dialects. It's very difficult to communicate. And we must consider massive media. Digital media only reaches young people, relatively young people. If we want to reach older people, we have to use other strategies. And that's what we've been doing with mass media. Looking to the future, we have to improve our reaction times to disasters. Talking about earthquakes, our tests don't work. We have to work with families to act on these earthquake tests or trials, preparations. We have to have geotraceability to design health policies in case of any natural disaster. Thank you. Thank you for your intervention. I think it's been an excellent conversation. We've learned a lot about challenges. It's a sign that there's still a lot that we can work on. We now have an overview of what's happening in Latin America, in different countries, and within the COVID-19 context. If any of you have a specific question, that you can ask it in the Q&A chat. So we have a question from Diego Macal. The pandemic exposed. Where's the question? So there's problems with internet to work, but not all Latin Americans have access to the internet. Yesterday, Facebook, WhatsApp fell, affecting all sorts of commercial businesses. So what can we do in Latin America to guarantee 100% access to the internet? Or at least for most people. Does the panel know of any effort to develop internally any software or infrastructure to have internet in Latin America? Would anybody want to talk about this topic of internet access in Latin America? I'd just like to say that progress varies from country to country. There's obviously a goal of my work with government, and we aspire to have absolute 100% internet access, but there's a lot of obstacles along the way involving financials, having the right alliances and the right strategies to reach this access, but still very deficient. I would say there's good progress in local governments. In local governments, there's increasing and improving experiences of having internet access in a public plaza, in a library, or in certain gathering areas. But that's at a very small communitary level. That's where we see very interesting projects in Argentina and in other countries. As Batilde said, the city of Buenos Aires, in plazas there's internet access. But as was asked about in general for Argentina, I'd just like to say a week ago, I was in Quiaca, which is the frontier limit between Argentina and Bolivia. I did all that trajectory back and forth because that's where you can really see the reality of Buenos Aires in metropolis. The truth is, we also have problems in Latin America involving how our country is distributed. We have countries, or we have regions, mountainous regions, where infrastructure for the internet to reach them is very limited or it's very expensive. Today, Latin American countries don't have the budget to undertake or create those infrastructures. Regarding the question specifically, is there any Latin American or Argentina software? We don't have any homemade software. We lack engineers, so we're not developing any software or anything of the like. Well, I can say something brief about
Bueno,
this.
quizá yo solamente pueda acotar algo breve.
It's not just a
Realmente
financial problem.
no solamente es un problema
Peru
financiero, sino también el
is a very diverse
geográfico, como
country
usted lo mencionaba.
in the
Como
rural
es un
areas,
país
in the
muy
Sierras, in
diverso
the mountains.
y nuestra zona rural en la sierra, pues
Is very hard to get to.
definitivamente es muy accidentado,
We need
tiene
to work a lot to access these
mucho,
areas.
se necesita trabajar bastante, ¿no? Para
But
poder acceder.
an
Pero uno
initiative
de
that
las
has had
actividades que
that
tiene
the
el Desarrollo Inclusión
Social
Social,
Inclusion Ministry has had
juntamente con los
is
gobiernos
creating
locales,
spaces
es que el poder
with
implementar esos
internet
espacios
for
donde
students
puedan
to
tener
access in the
internet
community
para
who wish
nuestros
to use
estudiantes,
them
que puedan
for
acceder
digital
de la
processes
manera
to
que
be able to
deseen
use them.
comunicarse, hacer procesos digitales. Ahorita se me dio el
Very
nombre
Christian
del
Juan Manuel,
candidato,
remember
ya
this.
lo recuerda, o Juan Manuel.
But it's a measure
Pero en todo caso, creo que
that's
eso es
been
una
slowly
medida que
implemented,
poco a poco se está
and the
implementando
population
en las
don't have
zonas de
access to
la
the internet, which is
población
rural
sin
areas.
acceso, que es la zona rural,
It's not
¿no?
necessarily them
No es
not having
porque
access
tengan
to
quizás el
a
acceso a un
phone,
equipo telefónico, sino es porque simplemente no hay cobertura.
but this is also true on the
Y la
coast
problemática en la
of
zona
Peru.
de la costa
There,
del
those are
Perú
different
quizás
issues.
también difiere,
Maybe they
¿no?
have a different type
Algunos
of
son
phone,
diferentes,
maybe they
otros
have prepaid
tienen
phone,
otro
or
tipo de celular porque tienen
and they don't have access to social
prepago,
media
entonces
or access to
tienen
educational
mayor
resources.
uso de aplicativos.
So all of this
Entonces,
evidence
toda
has
esa
to be gathered
problemática también tiene que ser,
to
creo,
attack the issue
reflectida para
in
poder
different
ver
areas and
el
regions.
problema desde diferentes zonas, ¿no?
We're talking about the
Se refería a los
Tambos,
tambos,
Nancy.
Nancy, ¿no es cierto?
Sí,
Los
sí,
tambos
Juan
que
Manuel,
forman
exacto.
parte del programa País que tiene los tambos y las plataformas integrantes.
Internet is a medium. There's other
El
mediums.
Internet es un medio.
If you want to talk
Hay
to
otros medios
people with
también.
70 or
Cuando
older
quieres comunicarte con la gente
age
mayor de
old,
70 años,
well, you're
no
gonna
va a
be,
haber
internet's
forma
not the way to reach
dependiendo
them.
del Internet que
We have to
puedan
think
entender.
strategically
Okay, o sea
in terms
que
of
tenemos
communications
que
to reach
pensar
everybody.
estratégicamente en el tema de comunicaciones para llegar
People
a
older than
todos
60 or
los
65
Estamos
are the most
hablando que
vulnerable
los
in
mayores
terms
de
of COVID.
60, 70 años son la gente
We have to
más
convince them
vulnerable para el COVID, a la que hay que
to vaccinate
convencerlos
themselves. There's
que
no
de
way we
ninguna
can
manera
allow
pueden dejar de
for them
vacunarse.
to not be vaccinated. If the state is only
Limitado.
using digital
Solamente
media to
utiliza el
communicate, then there's
medio,
a
virtual
huge
para
segment of the
comunicarse,
population
el resto de la población
that
monstruosamente
never
grande
realized that they
que
could
nunca se
already get their
enteró
vaccines
que él ya
2
estaba
or
listo
3
para
blocks down their
vacunarse o que
street,
tenía que irse a vacunar a 10 cuadras
and to tell them to
de su
rush there,
casa
so
y que
otherwise they won't
corra
reach or
porque
get a
ya se
vaccine.
vacuna, bla, bla, bla. O sea,
So
tenemos
the
que
communication
poner esto en
professionals
manos de
evidently
profesionales de la
have to
comunicación y
create the communication channels,
evidentemente crear
but it's
los
not just
canales de
internet. There's many other ways
Pero ojo, no
that we can
solamente es
use
internet. Hay muchas otras
to
formas
achieve
que
the goal of
podemos
communication,
utilizar para poder
which is
lograr
huge.
el objetivo de la comunicación, que es cambiar hábitos. Sí, lo más difícil.
Thank you, Juan Manuel. Thank you for your intervention.
Buenísimo, Juan Manuel. Gracias, gracias por tu aporte. Gracias a
Thank
todos
you
por
everyone for your
aporte
intervention in this conference.
que-
It's
que
been
nos
very
han dado aquí en esta conferencia,
enlightening, the information we have
la
received
información que hemos recibido.
from all of these different
Estoy
sectors.
seguro también que todos los participantes pues se llevan
Many
muchos
ideas,
retos,
many projects to
pero
develop
muchas ideas también
from this
para
reunion.
poder desarrollar, que es la idea de esta
Thank you everyone for being in this
Les agradecemos
participation.
a
Thank you,
todos por
Rocio.
estar
Thank you, Nancy,
presentes.
Juan Manuel,
Gracias,
Betilde.
Rocío, gracias,
Thank you for
Batilde,
giving us some of
Nancy,
your
Juan
time
Manuel.
to be with us.
Muchas gracias por haber dado su
And thank you
tiempo
to
para
all the
estar con nosotros.
participants.
Y bueno, también gracias a todos
Please
los
remain
participantes.
connected because we'll have
Nos
new
pedimos que
or
estén conectados
different
al mismo porque se vienen más
participations.
conferencias y más espacios de aprendizaje y de conexión. Gracias. Chao, chao.
Chao, gracias.
Chao.
Gracias, buen día a todos.
Muchas gracias. Hasta luego. Hasta la próxima.